So today we will learn about edema, which is a hemodynamic disorder. The pathology of edema we will learn. So before we start learning about hemodynamic disorders, we need to understand how is the hemodynamic balance. So actually, we are the human beings, and in our body there are water and electrolyte presence. These are the main constituents of our body. Now the water is present into two compartments, intracellular compartment and extracellular compartment. We know it. 33% of water is there in the intracellular compartment and 27% of water is present in the extracellular compartment. Now in the extracellular compartment we know that our body constituents are water and the electrolytes. Now the water is present into two compartments, extracellular compartment and intracellular compartment. So intracellular compartment and extracellular compartment, and in the extracellular compartment there are 27% of water is present, and in the intracellular compartment there are 33% of water is present. Now we know that there is a space called as the interstitial space, such as if it is a cell and if it is another cell, then if there are too many cells, then the space in between these two cells will be called as the interstitial space. So this space also holds some water. There are water present over here, and this water will constitute 12% of the body's weight. So if 12% of body fluid will be present of the body's weight in the interstitial space, this will be normal. But whenever abnormal and excessive accumulation of body fluid occurs in the interstitium, it will lead to formation of edema. So what is edema? This is abnormal and excessive accumulation of body fluid in the interstitium. Whenever there will be disturbance in the balance of fluid and electrolyte in our body, it will lead to production of some disease and disorders. So one of such disorder is edema, which is excessive and abnormal accumulation of water into the interstitial. And this edema is of two types. One is generalized edema and the second one is the local edema. So generalized edema is accumulation of fluid in the soft tissue. Swelling of the soft tissues is called as generalized edema. So this is also called as anasarca. But in case of local edema, whenever fluid accumulation occurs in the serous cavity, we know the serous cavity is the mesothelium lining body cavities, such as the spaces in our body, such as the peritoneum, pericardium, pleural cavity. So these are the serous cavities. Whenever fluid accumulates into these cavities, it will be called as localized edema. Now localized edema is having different names according to the site of their formation, such as localized edema of the pleural cavity will be known as hydrothorax. Pleural cavity, hydrothorax. Such as here are the names: pleura, whenever edema occurs in the pleura, it is called as hydrothorax. Whenever it occurs in the pericardium, it is called as hydropericardium. When it occurs in the peritoneum space, peritoneum cavity, it will be called as hydroperitoneum, which is also called as ascites. Now clinically, edema can also be divided into two types. Clinical edema, two types: pitting edema, non-pitting edema. So pitting edema is a type of edema whenever you will apply pressure on the swelling. If it displacement occurs, then it will be called as pitting edema. Examples are cardiogenic edema, renal edema. So pitting edema, examples are cardiogenic and renal edema. Now if displacement won't be there after applying pressure, if it remains the same, it will be called as non-pitting edema, such as in case of mixed edema we know, and also the elephantiasis, which is filariasis, swelling of the legs, we know. Swelling of the legs due to filarial worms, because edema only occurs whenever the hemodynamic balance in our body gets disturbed. The electrolyte and water balance gets disturbed, then the edema will occur. So we need to understand how is the balance maintained. So there are actually two deriving forces. What are the forces? One is the hydrostatic pressure, we have learnt about it. One is the hydrostatic pressure. Second one is the blood colloidal osmotic pressure, or the colloidal osmotic pressure, which is also called as the plasma oncotic pressure. So these are the two main deriving forces. Now let me tell you, suppose this is the artery and the artery gets divided into small arterioles. These are the arterioles. So what happens? There is a pressure or force which is called as the hydrostatic pressure. So what is the function of hydrostatic pressure? If you will think this to be an artery, then hydrostatic pressure is a force that will pull the blood, or then the blood will give a pressure, or it will exert some pressure on the artery wall. So this pressure will be called as the hydrostatic pressure. So this is the pressure exerted by the blood on the arterial wall is called as hydrostatic pressure. And the hydrostatic pressure is more in the artery side, and it is more in the arteriolar end. Hydrostatic pressure over here is increased. So due to increased hydrostatic pressure, blood or body fluid will try to escape from this arterioles, because there are some pores present in the capillaries. These are the arteriolar ends actually. So here there are so many pores, and here the hydrostatic pressure is also increased. So therefore body fluid will try to escape, and it will come to this space. This is extracellular space. So it will get accumulated into extracellular. So if the body fluid will try to accumulate into the extracellular space continuously, then edema will occur. But what happens? There is some other force which is called as the colloidal osmotic pressure. We know what is osmotic pressure. Osmotic pressure is the force which leads to osmosis, and osmosis is the process where body fluid moves to the area of increased concentration. So if it is a vein, we know that there are more protein particles, there are some RBC, some elements. So many elements are there in comparison to the extracellular fluid. So the concentration over here inside the vein and in these venular ends is more than the extracellular space. So therefore body fluid will try to reabsorb or re-enter into the venular end. So therefore there is a balance in between the extracellular fluid and the intracellular fluid, because in one hand the hydrostatic pressure is pulling the fluid out from the vessel, and on the other hand the osmotic pressure is taking the body fluid inside the vessel. And this general process to maintain the body fluid balance in our body by hydrostatic pressure and the colloidal osmotic pressure is called as the Starling's force. And whenever any disturbance occurs in between the balance of these two forces, edema formation occurs. We must understand the causes. So what can be the cause? As we learned the normal mechanism, whenever at the arteriolar end, what happens? The hydrostatic pressure is increased. So hydrostatic pressure is increased, therefore it will lead to escape of more and more body fluid into the extravascular space. So these type of edema due to increased hydrostatic pressure oftenly seen in patients with congestive cardiac failure. So after a cardiac failure, the heart muscles gets weakened. It cannot pump sufficient amount of blood into the aorta. Then what happens? The blood tries to back up into the veins, into the pulmonary veins. There are pulmonary veins, we know 4 pulmonary veins, and there are aorta. So if the cardiac output will be decreased, by any chance this blood will try to back up into the veins. Therefore there will be a tendency of the blood to flow through the lungs more and more. So in the capillaries inside the lungs, the pressure will be more, and more pressure will be exerted on the air spaces as well. So in the alveoli there will be formation of edema due to increased body fluid volume, or due to increased pressure this body fluid will accumulate into the alveoli. Okay, so this will lead to edema formation. So if increased hydrostatic pressure is causing edema, because hydrostatic pressure increasing, more fluid is escaping into the extravascular space, it will lead to edema formation. So if this can be a cause, then decreased colloidal osmotic pressure can also be a cause of edema formation. Colloidal osmotic pressure is decreased, less entry of water into the vessel's back, more accumulation into the extracellular space, therefore it will also lead to edema formation. So these type of edema formation occurs more in case of nephrotic syndrome. And this type of edema due to decreased colloidal osmotic pressure can occur due to glomerulonephritis, due to nephrotic syndrome, due to malnutrition, due to liver cirrhosis and protein losing enteropathy. So in these conditions, especially in case of nephrotic syndrome, what happens? More protein excretes out through the urine, more protein accumulates into the extracellular space, leading to less amount of protein level into the blood serum. So in the extracellular space, protein concentration increasing, so concentration is increasing, therefore body fluid due to osmotic pressure will move to the extracellular space, so therefore it will lead to formation of edema. And what is the other term I used is protein losing enteropathy. So this is a condition when the protein leaks, like albumin and other protein, they will leak from the GIT, gastrointestinal tract, and they will come into the peritoneum cavity, which will lead to ascites formation and many more. Okay, the other cause can be lymphatic obstruction. Obstruction or blockage can occur into the lymphatic system. So whenever there is a blockage, more and more fluid from the extracellular space, it will try to accumulate into the tissue will start swelling, so therefore it will lead to formation of some generalized edema. Now sodium and water retention. So this is these two words are complementary. Sodium retention will lead to accumulation of water in our body, we all know that. So whenever there is some conditions like renal failure, kidneys are not able to excrete the sodium and potassiums out effectively, reabsorption is more in the kidneys of sodium and potassium, then the concentration of sodium potassium is increasing. So sodium retain more concentration of sodium in the body fluids, it will retain more and more water in the body, so therefore it will lead to formation of a edema. And edema can also occur due to disturbance in Rash mechanism, I mean abnormal secretion of aldosterone in our body, and if we will take excessive sodium, it will also lead to retention of water, accumulation of water in our body. Then the other cause can be inflammatory cause, because we know in case of some acute and chronic inflammation, edema formation can occur. Now we will try to know about the pathogenesis of edema. So first I will start with the pathogenesis of cardiac edema. So cardiac edema occurs from cardiac failure. So whenever there is a heart failure or cardiac failure, what will happen? Cardiac failure had occurred, therefore heart is not able to pump enough blood now, so cardiac output will be decreased. Cardiac output is decreased, so less blood is there in the aorta, less blood in the aorta, and aorta will lead to formation of arteries. Arteries will produce arterioles, arterioles will supply the body. So therefore arteries, in the arteries circulation is decreased, so arterial circulation is decreased, so renal blood flow will therefore decrease. Blood flow in all the systems will be decreased, but we will point it out here, the renal blood flow. Renal blood flow is reduced. Why we are pointing it out? Because kidneys are having some counteract mechanism. So if blood flow will be reduced in the kidneys will start reabsorbing sodium, potassium and other nutrients to increase the concentration of the body fluid. So if the concentration is increased due to osmotic pressure, more body fluid will start accumulating where the concentration is more, which will lead to formation of edema. So here we will now understand the pathogenesis. Such as when the heart failure occurs, heart muscles are damaged, it cannot pump enough amount of blood, therefore cardiac output is reduced. Cardiac output reduced, less supply of blood into the aorta, less supply into the arteries, arterial circulation is decreased. Arterial circulation decreased, blood supply is decreased in all the systems of our body. But we will point out the renal blood flow. Why, Karun? Why? Because kidneys can counteract this condition. So increased secretion of renin from the kidneys, which will activate the Rash mechanism. We know renin, angiotensin, aldosterone system. Here activation of renin, angiotensin, aldosterone axis, which does what? Which will increase the reabsorption of sodium and potassium into our body, which will lead to increase in plasma volume. If the plasma volume will be increased, here transudation mean escaping of the body fluid from the transudation occurs due to hydrostatic pressure, increased hydrostatic pressure. Here in the arteries, more plasma is there in the arteries, so more transudation, more escape of the body fluid at the arteriolar end due to increased hydrostatic pressure. So more transudation, more accumulation of water into these spaces, extracellular spaces. More accumulation of water in the extracellular spaces, which will lead to formation of edema. So this was the pathogenesis of cardiogenic edema. Another pathogenesis is there of the renal edema. Renal edema occurs due to nephrotic syndrome, acute glomerulonephritis, cirrhosis, and malnutrition. About the renal edema, what will happen? The plasma oncotic pressure will be reduced. Why plasma oncotic pressure is reduced? Because in case of nephrotic syndrome, we have discussed that the protein concentration in the blood serum is reduced. So if there is less protein, less concentration is there is less concentration, so body fluid will not move into the veins. Body fluid will not get reabsorbed into the veins, because the concentration is less here. So this is against the law of osmosis. So therefore, reduced plasma oncotic pressure will lead to decreased effective arterial circulation. Somehow the arterial circulation in our body will be decreased, which will again, arterial circulation decreased means blood supply is decreased in all the systems in our body, all the cells, all the tissues. But we will point out the renal blood flow, because kidneys are having some mechanism to counteract this condition. So increased secretion of renin, again activation of renin angiotensin aldosterone axis, increased renal reabsorption of sodium and water, increased plasma volume, and increased transudation. Increased transudation occurs, which will lead to formation of edema. So now about the clinical profile. So what is clinical profile? Here clinical profile means the other causes that can lead to formation of edema. In case of cardiogenic edema, it occurs due to cardiac failure, congestive cardiac failure. So in this, and we know that cardiogenic edema is a type of pitting edema. Cardiogenic edema and renal edema are a type of pitting edema. So what is pitting edema? Whenever we apply pressure and if the edema displaces, the body fluid displaces, it will be called as pitting edema. Now in case of patients with congestive cardiac failure, the edema occurs in the extremities. In case of ambulatory patients means who are not bedridden, can move. In case of them, edema occurs in the extremities, and in case of bedridden patients, edema occurs in the sacrum region, in the back. Okay, and edema can also occur into the serous cavities. Serous cavities means we know all the body cavities such as pleura, such as pericardium, such as peritoneum, these cavities. Now what about the renal edema? So renal edema occurs from, we know, decreased protein level in our serum, the conditions which lead to decreased protein level in our body, such as glomerulonephritis, nephrotic syndrome, these things, and protein losing enteropathy. So what happens? This is the most severe case, and it is having a renal edema. It will be marked by edema in the periorbital tissue. So what is orbit? We know the anatomical term of our eyes. These are called as orbits. Orbits means eyes. So periorbital tissue means tissue around the eyes. This will get swelled, which will indicate renal edema formation. So renal edema can also occur in the ankle region. So in case of cardiogenic edema, if the edema will occur in the extremities of an ambulatory patient and at the back or sacral region of a bedridden patient, we will get to know this is a cardiogenic edema. But if the edema will occur here in the periorbital tissue and in the ankle region, then we will think that it is then we will be able to identify it to be a renal edema, not a cardiogenic edema. Whenever there is a cardiac failure, congestive cardiac failure, blood will try to back up in the veins, which will tend to flow through the lungs. It will exert more pressure on the capillaries, alveolar capillaries, on the air spaces, which will lead to accumulation of body fluid into the alveoli. Therefore pulmonary edema will occur. The other causes can also be ARDS, acute respiratory distress syndrome, some stenosis, mitral valve stenosis can also lead to this type of edema formation. And in case of this type of edema, there will be, in radiograph, if we will do x-rays and all, in radiograph we will see there are some linear lines which are called as Carly B lines, which will indicate dilation of the lymphatics. And in case of pulmonary edema, the lungs will be heavy, it will be moist, and if we will take a slice of lung, by pressing it, by applying pressure on it, some pinkish frothy fluid will come out. Okay, and microscopically we will see that the alveoli are congested, and these are congested, and some proteinaceous edematic fluid is there inside it. Okay, and in case of cerebral edema, there are three types of cerebral edema. Cerebrum, we know this is our brain, and it is enclosed in a skull case. So there are three types of edema that occurs in the cerebrum. These are vasogenic edema, cytotoxic edema, and interstitial edema. So vasogenic edema is formed whenever there is a disruption in the blood-brain barrier. We know the blood-brain barrier is there. So whenever there is a disruption, it will lead to accumulation of fluid, and this type of edema will be called as vasogenic edema. This is most common type, and it can occur, it is most common form, and it is seen in conditions like infarction of brain abscess, and brain tumor. And also cytotoxic edema, whenever ischemia will occur into the brain tissues, extracellular fluid will try to come to supply nutrients to the brain tissues, which will accumulate into the tissues and will lead to formation of edema. This is called as cytotoxic edema. Now another type of cerebral edema is interstitial edema. So this is caused by escape of cerebrovascular fluid, CSF, into the interstitial space. So this will lead to formation of interstitial edema. So this was all about edema, the definition, the causes, the pathogenesis, and the clinical profile. This much.